Well, good afternoon, and thanks for joining us once again in our Department of Labor and Economic Opportunity webinar series focused in on workplace mental health. We're about a week or so out from the holidays, so I hope everybody's ready and prepared. I know that I'm in crunch time and I'm not ready or prepared. Definitely a difficult time. If you didn't catch our webinar last month, we really talked about the stress that the holidays can create for people. So that's available on our website. I encourage you to check it out if you're feeling really crunched, stressful, maybe even having some grief right now. There's some good information there from our friends at the University of Michigan. Dr. Reba was our guest and really talked about what the holidays can do for people, both in a positive way, but some of the challenges it creates. There is a Q&A box on your screen at the top. You can submit questions at any time during the presentation today, and we'll get to as many as we can at the end. And if you haven't already, where those videos are, but make sure you sign up for emails on our website at michigan.gov/workplace mental health. That's where all the recordings are from previous webinars. We have other resources and information up there for you that you can check out, that you can start thinking about for yourself or integration into your workplace. And as you all know, our goal is to provide working people and employers with information about issues impacting workplaces, impacting our mental health, and options for addressing those issues. And we focus in on those three pillars we've talked a lot about. Those are things that are happening in the workplace themselves, things that are affecting the workplace, and then individual behavioral health supports. We try to make sure we're hitting on these all the time. And today we're going to do that as well. And I think that we all know that movement, physical fitness, or whatever it may be for us is strongly connected to how we feel, how we function, and how we can get better. I know that I've shared with many of you before that I am a person that has to exercise regularly, and not so much because I'm so vain, I feel like I need to look good and be ready for beach season. It's because I can feel my mental health deteriorate if I go long periods without exercise. So if you talk to me, you ever see me and you say, "Hey, Sean, when's the last time you exercised?" And I tell you it's been a month or more, I'm in trouble. I'm probably really struggling because I deteriorate that fast. So this is a big part of my life. But for many people, it's just not that simple, right? We either don't have the time, maybe we don't have the motivation, maybe we have some kind of limitations that prevent us from feeling like there are things that we can do. And it's often very difficult to figure out what to do. If you sort of like Google search, like, how do I exercise or how do I do physical fitness? It gets really weird really fast. And it's really hard to figure out what works for you. So we have a great friend of the Michigan Department of Labor today to help us with this. Mike Stack is the founder and CEO of Applied Fitness Solutions and Frontline Fitness Pros. He's an expert in kinesiology. He has a wellness paradox podcast that he does bi-weekly, we've just learned, and is a guest lecturer with the University of Michigan. And they also support his podcast. And he was a great friend with us during COVID, helping fitness centers do everything that they could do to keep their patrons safe, to keep themselves open. Just a wonderful guest, and I really appreciate you joining us so much today, Mike. For all of you that are watching, you won't get the chance to do this, but anytime I talk to Mike, I ask him about, like, I get free advice, like on things that I could do. How can I improve this or do that? He's always ready, willing, and able, and he's going to give us some of that today. So you heard me open up a little bit there, Mike, and people talk about like physical activity and exercise, and it really feels like it's the same thing. Can you kind of describe, are they the same thing?
Yeah, and I think that's a great starting point. Super excited to join everyone today. I always say there's probably no more beneficial thing on a minute-by-minute basis you can do for your health than to move. If you only eat healthy for 15 minutes a week, it probably doesn't make that big of a difference in your health. But if you move for 15 minutes a week, as we're going to talk about today, going from no movement to 15 minutes of movement can actually have a pretty profound impact on your health. So let's frame up the conversation, because Sean, you're absolutely right. People talk about physical activity, movement, exercise, fitness, and all these terms get thrown around. So I think it's important to level set on these terms initially. And first, we'll start with physical activity, which is any bodily movement that produces energy expenditure. So if I was standing up and walking back and forth in my office and moving my arms and gesturing, that would be, by definition, physical activity. Physical activity is infinite. There's almost no limitation to what could be considered physical activity. This could be cleaning your house. This could be playing with your kids. This could be walking your dog. Normally, physical activity is not as intense or as purposeful as exercise, but we really do derive significant health benefits from physical activity. So one of the things we'll talk about as we go on today is just the thought that if you aren't physically active right now, if you aren't doing substantial amounts of movement during your day, that's increasing your energy expenditure levels, that's going to be the place to start. So that I kind of look at as the base of the pyramid, the foundation. And then you go a level up from there, and that's when you get into exercise. Exercise is much more finite in that it's not, anything you could possibly think of that involves movement. Exercise is cycling, it's running, it's lifting weights, it's doing yoga. There's a lot of things you can do, but it certainly is more finite. And it's more purposeful in that it's designed to improve some specific aspect of health or skill related physical fitness. So aerobic fitness, muscular fitness, flexibility. And in doing that, improving your fitness is certainly very, very important to improving your health. But when I go back to what I said initially, the most important thing for improving your health is just leading a physically active lifestyle. And that's meeting that definition of just getting up and moving around to whatever extent is realistic during the course of your day. So I look at the pathway or the runway to improving health through movement as starting with physical activity, just moving around and being active, and then progressing to exercise if you're not already physically active. I think so many people go from sedentary lifestyle to exercise, and that's sometimes too big of a jump. And I like to think of it more in a stepwise fashion. Start being physically active and then move to exercise.
Yeah, so you mentioned sedentary lifestyles, and I work in an office, and maybe many of the people watching this work in sort of an office environment. We know over the years we're sitting more, we're crouched more. We're getting better about these standing desks. You can tell I'm at a standing desk. Mm-hmm. We're getting better about that kind of stuff, but we're just sitting a lot. And then you kind of get in your car and you sit. You get home and you sit, and you're just kind of sedentary. And you're talking about moving to physical activity. So what are you really getting at? Like, how do I go from like being the office person with the sedentary style to that physical activity, and how different are they?
Yeah, and so now this brings in the other term, which is sedentary lifestyle, and the idea that being sedentary and being physically active aren't the same thing. They're different sides of different coins. So if I said physical activity was the foundation, kind of the elemental component below that is just not being sedentary in the first place a lot during your day. So ideally, if we're talking about actionables, if I'm trying to get somebody to be more active, the first thing I'm trying to do is just encourage less sitting during the day. Now, we all have to be pragmatic. We work at computers, we work in offices. We all can't have a treadmill desk. I don't know about you, but if you've ever been on a Zoom call with somebody at a treadmill desk that's bopping up and down like this, like you almost get seasick. So like I don't even know if I advocate for that. But what the research tells us is that if we get up ideally every 60 minutes, and move for about 5 minutes. Have that be a walk around the office, have that be, going up and down stairs, even standing up and doing squats and arm swings or whatever you can do in the space around you. Not only does that improve your cardiometabolic health, specifically it helps your body become more insulin sensitive and all the things that are associated with being metabolically healthy, but it really improves your mental health and your cognition. There's a lot of really fascinating research out there that shows how effective we are cognitively after we've done a little bit of movement. So, when I think of this hierarchy, I think, can I build in movement breaks into my day? I'm not saying exercise breaks. Like, I don't expect anyone, within reason. Sean, you may do this, but I don't know if anybody else does. You don't have to do push-ups, in your office or like burpees or something like that. But doing something that involves some kind of moving can make a big difference. And that is really the first step, is just reducing the amount of time that we are sedentary as much as feasible. And that starts to increment up that physical activity number. And if you could do 5 minutes breaks through the 8 hours of your workday, you've accumulated 40 minutes a day. And over the course of the week, that will actually cause you to meet the guideline for physical activity, which, according to the CDC, is 150 minutes per week. So again, the runway that gets you to exercise is first physical activity, which that's predicated on not being as sedentary.
Yeah, I like that. I'll come back to that 150-minute concept, but I have a question on that. So one thing that I learned about myself, now I said I need to exercise for my mental health. I wasn't always like that. You know, I went through a lot of years in an office environment where I was extremely sedentary. And what you find, or what I found for me, is the more you do that, the more you continue to do that. And then when you do try to get more physically active, you get like, there's all these aches and pains now that weren't there before, even though you're not really doing anything to aggravate stuff, but they start to develop. So if I'm quite sedentary right now, like what are some of the aches and pains that are starting to happen to me from sitting or being sedentary? And then are there things I can do to kind of alleviate that?
Yeah, and I'll answer your question, but anyone who sits in their chair all day long probably knows some of these areas because they deal with it on a day-by-day basis. Neck pain, shoulder pain, upper back pain, lower back pain, hip pain. I'll put up a slide here really quick for everyone to look at because I think it's pretty instructive of kind of how we are during the course of our day. So, I mean, this is kind of the common desk
Yes.
and life posture that we deal with. So you could imagine, this woman over on the left, how tight her shoulders are getting, how tight her hip is getting, the position that her neck is in. So that's a posture we're all very familiar with. And we're actually going to send you a PowerPoint out after this presentation with some exercises you could do to improve the mobility and the strength of the postural muscles that are affected by sitting. But I think one of the important things that I always like to bring up with posture-related aches and pains, people often assume it's just stretching muscles. And stretching muscles is part of it, but it's also strengthening muscles. The way the human body works is kind of fascinating. On one side of a joint, if it's tight, the other side of the joint gets progressively weaker. And there's some physiological reasons for that we won't get into. But if I am tight in my shoulders because I'm sitting like this all day long, it's not just enough for me to stretch my chest muscles. I also need to strengthen my upper back muscles to ensure my neuromuscular system puts my joint in the right position. Or for those of us that deal with hip tightness or lower back tightness, it's just not enough to stretch the hips or stretch the lower back. We also have to strengthen the glute muscles to make sure we could put the pelvis in the right position. So I think, when we think of how we improve postural aches and pains, which I think that's the first place to start, because if you're hurting when you're just sitting there, odds are when you start to exercise more intensely, that could just exacerbate that. Starting with some simple stretching and strengthening exercises, that the ones that we'll send you out with this PowerPoint, you can actually do in your office. These aren't things that are so intense that you're sweating and you're breathing heavy. These are things that do a really good job of stretching and strengthening the key areas in the body that start to alleviate some of those postural aches and pains.
Yeah, that's quite interesting. So let's take that one more step, and hopefully I'll be on the right flow for the information you're trying to get out there. But so I've been sedentary for a long time. I have those aches and pains. Maybe I've done some stretching, but it hurts. So like, are there certain movements you would say, is it just that 5 minutes, get up and walk around? Start there for a couple months and then just keep sort of growing out? What would your very first thing, if you saw me and I've been sedentary for a long time and I'm hunched, what would the first thing you'd tell me to do be?
Well, the first thing I would actually tell you to do is look at your desk position at work. That'd actually be the first thing I would tell you to do. And so I'll put up another slide here, and again we'll send these out to you so you have a chance to see them. But there certainly is a way to make sure you get in the right posture at work. So when I share this, you see here's the hunch posture that we don't want to have. This is proper work posture where the shoulders are more open, the hips are more open. So that's where I would actually start with you, is just seeing if I can get you in the right posture. But typically what we will tend to do with people that have tightness and they're hunched over like this, we tend to want to do a lot of chest stretching. So, putting your arm up on a wall and stretching your chest muscles. taking in your arms and squeezing your shoulder blades together to strengthen your back muscles. Again, we're going to include these in the PowerPoint, but those are some good starting exercises. But I also think what's really important when you're starting out, and this I think is a very important way to think about moving more, is movement and exercise and physical activity. It's kind of like cooking. You can always add, but you have a hard time taking away after you've done too much. So I think starting slow and low is really the best way to go about it. So if you're not doing any activity at all, going from 0 minutes a day to 5 minutes a day, believe it or not, can actually have a pretty profound impact on your health if you do that consistently enough. So what I would suggest is start with a small amount of movement and physical activity during your day that you feel comfortable with, that doesn't elicit pain. Now, that doesn't mean it might not be a little uncomfortable. And so I think that's an important distinction, is that there's pain, and then there's a little bit of discomfort. You know, when you start to move and you're not moving a lot, you're going to have a little bit of discomfort, and that's totally normal. And normally I tell people, put it on a scale of 1 to 10. If it's anything that's a 6 or more in terms of your pain level, that's probably a sign you shouldn't be doing it. But, you know, if you're like this all day long, and then you get up and you start moving around and you're like this, and stuff's a little uncomfortable, and maybe you're in a 1 through 5 zone on a scale of 10, that's fine, because your body just probably needs to get moving a little bit more. But I would say more than anything else, starting low and slow and then progressing is the best way to ensure that you don't end up with an ache or a pain that leads into an injury. This is why I think most people get themselves in trouble when they go from no physical activity or very little in a highly sedentary lifestyle, and then they get into the gym 3, 4, or 5 days a week in January for an hour, and then they end up with a case of shoulder or knee tendonitis a week later. You know, I'll say this. I am a fitness business owner, so I make my money by people coming into my business and utilizing our fitness services. But I would much rather have somebody build up to being able to do the things they can do in my business, rather than just trying to rush in here right off their couch, and that just might be too much too quick for them.
Yeah, and I really love that. I love this distinction you're making between the concept of physical activity and exercise, because I think inherently we know that we need to do more, but that sort of taking the step of like, oh, now I need the gym clothes, or I got to buy a treadmill, or I got to do all this extra stuff, or I don't have time. You're literally, what you're telling me is it doesn't, going from 0 to 15 on the physical activity scale doesn't really mean you need anything else. It just means start incorporating, like getting up from your workstation during the day, or if you can't do that, carve out that 15 minutes on when you get home, 20 minutes, whatever, and just do an easy walk. You know, like you don't have to do anything crazy, or whatever it is you can do, depending on your ability.
Yeah, and I think to whatever extent you can build it into your day organically is great. Like if you do chores during your day in your house, is there a way for you to do them standing up rather than sitting down? Is there a way for you to shovel your own snow or mow your own grass rather than have, pay somebody else to do it? Like there's all kinds of ways that we can incorporate it into our day. If you have kids or grandkids, that is such a great way to incorporate activity into your day where you're actively playing with them. I think there's probably, especially for the older demographic, the aging demographic, playing with their grandkids. We know that one of the most deleterious events during the aging process is the inability to get up off the ground effectively. And I'll tell you what, I watched my parents play with my 2 little nephews, and like they're down on the ground and up constantly, and they don't even realize that they're performing physical activity because they're just having fun with my nephews. But in actuality, they're doing some really profound physical activity because it involves doing an activity that most people struggle with as they age. So it needs to be meaningful for you. It needs to be enjoyable for you. It needs to be feasible in your lifestyle. What all the research shows is that it doesn't really matter what you do when you're talking about physical activity to improve your baseline health. It just matters that you start to become physically active. If you want to improve your physical fitness, like you want to get stronger, improve your aerobic capacity, body, maybe build bigger muscles, whatever it might be. That requires a little bit more of a focused and intensive exercise routine, but the on-ramp here is physical activity. Start with movement and then move your way towards more structured exercise.
Gotcha. Well, and I like that. I was gonna, you already covered it, but the sort of that last point was it's not a walk. I mean, it's whatever works for you. It doesn't have to be a walk. It's just you got to be moving, and however that works for you. I would, and you can tell me if I'm nuts on this, and I would never claim I have perfect posture or anything like that. But as I kind of moved from that really rolled over sedentary kind of style, you said a little bit of discomfort. What I really noticed early on was all of these muscles in my back starting to feel weird. They never hurt, but you could feel they were weird, as like you were saying, because this was tight and this got weak. As you start to move more, you'll start to feel those muscles kind of, I don't know, come back to life, so to speak, right? And help you out with your posture.
Yeah, again, if you're not using muscles or if you're not using certain parts of your body, you could expect some discomfort in starting to use those areas again. And I like to remind people that kind of discomfort is actually a really good thing. And I think you need to reframe it like, oh man, this discomfort isn't good. Pain is never good, but discomfort when it comes to movement and exercise means the body's feeling something that's uncomfortable, and its response to that is going to be a positive adaptation to that area of the body so it doesn't feel that discomfort anymore. So, yeah, when you started to get up more and kind of improve your posture, it was a little uncomfortable, but eventually your body figured out, hey, Sean's going to keep doing this, so I better loosen these muscles up and strengthen these muscles up so it's not as difficult for me to get into this postural position during the course of the day. So that's the amazing thing about the human body. It adapts. We know exercise and physical activity works. We don't have to prove that to anybody anymore. The challenge with it is just getting people to do it frequently and long enough to actually derive the benefit from it. And that, I think, is why it's so important to emphasize starting with physical activity and building to exercise rather than just jumping right to exercise.
So we could tell everybody listening, wherever you're at, really sedentary, really active, whatever else, like there's a way for you to get engaged.
Absolutely, absolutely. And along those lines, I hope that I'm going to show something right now that I hope will actually cause people to be a little bit more motivated to move, because we know exercise works, but I want to show you how well it actually works. So I think you guys can see my screen, right, Sean?
Yep.
So this is a great study from the mid-90s, and I'll jump right to the punchline of this study. It's a study that looks at all-cause mortality with death rate. So the higher the bar, the worse here. And the thing that jumps out at you in this study is that low fitness, specifically low aerobic fitness, was actually a bigger predictor of mortality than cigarette smoking, which I think is a pretty profound finding. And again, this study was published in 1996, so it's not like we just learned this. So, I mean, look at that as such an important advocacy piece for why we need to move and improve our overall physical activity status. Now, another really compelling piece, and this goes back to the start low and go slow and build, is from this same researcher, actually published back in the late 80s, that looked at mortality rates. So again, the higher the bar, the worse here, the lower the bar, the better, and different levels of aerobic fitness. And basically what this graph shows is if you go from the lowest level of aerobic fitness to the second lowest level of aerobic fitness, you see a greater than a 50% reduction in your mortality rate. So basically what this is saying is you don't have to go from really out of shape to really in shape to dramatically improve your health. You just have to go from really out of shape to a little bit less really out of shape. And the way I put it is this: it's the flattening the curve from a fitness perspective. We talked about this during COVID, but this is the fitness flattening of the curve. You don't have to go from being a couch potato to a jack potato to greatly improve your health. You just have to be a slightly more active potato. And this line right here, the slope of the line, That's probably the most important public health message that we don't often talk about. So going from 0 minutes to 15 minutes of physical activity every week, or 0 to 20 minutes, is profoundly more important than going from 135 to 150 minutes to meet that guideline. So I think the big thing I'd want to leave everyone with is start somewhere. And going from nothing to something makes a profound difference. And I hope everyone can find a way to build that into their day.
I absolutely love that. A slide had me cracking up. I wasn't on the screen, so nobody could see me, but I thought it was really funny that you don't have to go to from a couch potato to a jacked potato, but you basically, that curve is so eye-opening. It's literally, to your point, just 0 to 15 is going to have this huge benefit. What an amazing, like, why aren't we hearing that more often?
Yeah, we need to hear it more often. You should also probably be amazed by how long it took me to find a flexing potato online. That's a lot of time in Google search right there. But you're right. And Sean, honestly, I think one of the reasons that we don't hear it more often is because the commercial fitness industry, my industry, really pushes, that you got to do these intense workouts multiple days a week. And yeah, those are good for a certain subset of the population. But when we're talking about just public health as a whole and physical activity, it's just that message. It's go from nothing to something. Do the best you can. Life's not perfect. And as long as you're doing your best to try to move at various points during your day, everything counts. You can accumulate 150 minutes per week if you break it up into 2, 3, 4, 5-minute bouts. But even if you get to 20 minutes in a week, you're going to be much healthier than if you were staying at 0 minutes.
I love it. I think, and even in my mind, I think I'm a pretty smart guy most of the time. And I always pictured the 150 minutes as like, I got to be in high aerobic state. I got to be pumping it hard, but thinking that, you don't need to think of it that way was really amazing. we do have a couple of questions. One is, have you had the opportunity, or have you seen what any employers are doing to proactively kind of incorporate this into their workplace?
Yeah, I've seen a handful. We've actually worked with a handful as well, where we've actually came up with certain types of physical activity and or movement routines that can be done during the day in offices, and they actually have it available either on their intranet, on some of their boards around their office. I do think, and I've really tried to be insistent on this with employers, if they could figure out a way to build it into the workday as a group, where you're not just kind of the one person that's getting up and squatting in your cubicle, like where everyone is doing it as a group. It's a real team building thing. It's a real kind of team bonding thing. And all the employers that we've ever implemented this with actually will tell you that their employees are more productive and more engaged after they do it, which is what all the research shows us. So yes. I would say the things that we're going to send out in the PowerPoint afterwards are basic stretches and exercises that can be done in a office environment that don't require any exercise equipment. But I would say to you, if you can find a way to carve it out in a couple of blocks during the day, 5 minutes here, 5 minutes there, and get everyone doing it at the same time, that seems to be the most successful way to implement it. And management and leadership has to be willing to do it just like everybody else, because that leadership, that management buy-in shows that it's something that's appropriate for the entire office to be doing.
Okay. One more question, and then I'll wrap it up. But any recommendations to promote mental health and fitness for remote workers that are currently, especially, trying to balance their limited capacity and wrap up year-end priorities?
Yeah, and mental health, and we kind of started with that. I will tell you that the benefits of exercise and physical activity are more profound than for mental health than they even are for physical health. I could spend hours talking on that. What I will tell you is that what I've seen done is kind of a very similar thing to what I just said is done in offices. If you can actually schedule Zoom times where the group actually does Zoom-based exercise. And here's the thing, like, if you don't want to be on your camera exercising and other people watching you, God knows I don't want that. Everyone gets on Zoom, turns their camera off, and then does the movements like that. I've also seen companies send out videos to their employees at certain points during the day and have them do an exercise break. I've seen people do a buddy system where 2 people call each other and they do their movements together. So what I've seen most effectively is when you add some structure with some element of community and camaraderie together, that seems to be the secret sauce for implementing this in during the day.
Okay. Well, perfect. Like what a great, you said do it as a group. So I was thinking like everybody watching, let's stand up, stretch our arms up a little bit, you know, just take a little motion there. But what a great topic. I really love it. Mike, we would love to have you back to dig further into things that people can be doing, that premise of that impact of just 0 to 15 and how big that can be for us. And recognizing that, you know, you don't have to go to 150 minutes of high aerobic activity to get these huge benefits. So this is so helpful. Really appreciate you joining us today. Thanks everybody watching. We'll get the webinar out, the recording out, as well as the slides that Mike has prepared. He has way more than just the few he showed you that include those stretches and other activities you can do. So thanks everybody for joining us once again.